In the greatest name of Almighty Allah, who is Rahman and Rahim. Welcome to Dr. Najam Lectures. Today we are going to learn about the Babinski reflex in the neonate or infant. For this, first of all, the neonate or infant should be in the lying position or the spine position. After that, you should have a blunt instrument. A blunt instrument is not a sharp object. It should not have the tip or the sharpness at the edge. It should be round or the flat end. For this purpose, you should use this blunt instrument, or you can also use your finger. For this, you can use this blunt instrument on the sole of the baby like this, and you move like this. Due to this placement or the movement, the baby will show the two types of the movements. First one is the dorsiflexion of the big toe. Like this big toe will move in the dorsum of the foot like this. And after that, the other planters will move in the flexion. The big toe is moved like the dorsiflexion, and the other planters will move in the flexion. This type of the flexion is normal up to the age of the 12 to 24 months of age or the neonate, because due to the inadequate myelination of the corticospinal tract after the 24 months of the age, there is a proper myelination of the corticospinal tract, and this kind of reflex is abnormal after the 24 years, and we will see in the different kind of the pathologies of the corticospinal tract pathology and the upper motor neuron ligands. Thank you for your attention.